Welcome to Pulse and Pressers, where critical care gets crystal clear. Today, we're diving into Cardizem, also known as Diltiazem, a drug that slows chaotic rhythms through precision and nodal control. It's the non-dihydropyridine calcium channel blocker that brings the heart back to balance, one beat at a time. Diltiazem is a class 4 antiarrhythmic, a non-dihydropyridine calcium channel blocker that works by inhibiting the L-type voltage-gated calcium channels, the primary receptor target found in both nodal tissue and vascular smooth muscle. By slowing calcium entry into pacemaker cells, it decreases conduction through the SA and AV nodes, lengthens refractory time, and relaxes vascular smooth muscle to reduce afterload. This dual effect slows the rhythm and softens the resistance, creating hemodynamic calm. Diltiazem is most often used to control ventricular response in atrial fibrillation or Flutter, where the goal is rate control, not rhythm conversion. It's also effective in paroxysmal supraventricular tachycardia and angina, where its calcium-blocking effects reduce myocardial oxygen consumption and ease coronary spasm. Diltiazem slows the storm. Amiodarone resets it. If your patient is stable but racing, Diltiazem is your rate controller. If the ventricle is weak, the blood pressure low, or the goal is rhythm restoration, amiodarone takes the lead. In the ICU, Diltiazem begins with an IV bolus, 0.25 milligrams per kilogram over 2 minutes. If the response is insufficient, a second bolus may be given, followed by a continuous infusion at 5 to 15 milligrams per hour. Once the rate stabilizes, transition to oral dosing, either short-acting divided doses or extended-release formulations for maintenance. Diltiazem undergoes extensive first-pass metabolism through CYP3A4, forming an active metabolite called Desacetyldiltiazem, which retains about half the potency of the parent compound. This prolongs clinical effect slightly beyond its 3 to 5 hour half-life. The drug is cleared hepatically and renally, meaning impaired liver or kidney function can increase exposure and prolong action. Extended release forms stretch the duration to roughly 9 hours, making them ideal for long-term control. In hepatic dysfunction, Diltiazem metabolism slows. Start lower, titrate slower, and monitor rhythm closely. In renal impairment, clearance is modestly affected, but accumulation can still occur with infusions. Always respect organ function when the margin for perfusion is thin. Diltiazem's benefit lies in efficiency. It slows the heart enough to allow better filling, reduces oxygen demand, and relaxes arterial tone through calcium channel blockade in smooth muscle. This dual action improves perfusion while easing the cardiac workload. Never pair Diltiazem with IV beta blockers or use it in patients with advanced AV block or decompensated heart failure. Together, these agents can stall the AV node entirely, causing severe bradycardia or asystole. Always check the rhythm and perfusion before pressing the calcium brake. The most common side effects stem from its mechanism: too much slowing or vasodilation. Expect hypotension, bradycardia, or mild dizziness. Peripheral edema may occur from smooth muscle relaxation, particularly in lower extremities. Continuous ECG and hemodynamic monitoring are mandatory during IV therapy. Check for slowing conduction, dropping pressure, or new heart failure signs. Once stability is achieved, taper the drip and bridge to oral dosing to maintain control. In atrial fibrillation with an accessory pathway, such as Wolff-Parkinson-White syndrome, avoid Diltiazem as it can accelerate conduction through the bypass tract. When rhythm is nodal, it pairs well with digoxin for chronic control. If bradycardia or hypotension develops, stop the infusion immediately and give calcium gluconate if toxicity is suspected. This summary ties the pharmacology together. Diltiazem acts on the L-type calcium channel to slow AV conduction and relax vascular tone. It's metabolized in the liver, forms an active metabolite, and requires careful titration in organ dysfunction. In short, precise control, reversible action, and predictable hemodynamics make it a favorite for rate control in the ICU. In critical care, not every arrhythmia demands a reset. Some simply need to be guided back into balance. Diltiazem restores order not by force, but through control. This is Pulse and Pressers. reflecting on the marvels of the human body.